everyone, welcome back to my channel, and in this video we will be talking about dental care during pregnancy. So let's get started. So one very important tip for women who are trying to get pregnant, that before getting pregnant all the women should visit a dental clinic and they should get a thorough dental checkup done, and during that time whatever problems they have, they should be taken care of before they actually get pregnant, so that they do not come across any kind of dental problem during their pregnancy period. Then another thing, the dentist should advise the patient on oral hygiene instructions and how the patient has to maintain oral hygiene during the pregnancy, and what all changes will take place in the oral cavity during pregnancy that needs to be informed to the patient. Then another important thing that you need to tell the patient is that after vomiting, the patient should not brush their teeth for at least 15 to 30 minutes of vomiting. We need to avoid morning appointments, and because there are high chances of vomiting during morning in pregnant patients. Then when the patient comes, we should tell them to avoid citrus and fatty foods before they come for treatment, because they can cause gastric upset and they can delay the gastric emptying time. Then another thing is, before starting the treatment, we should ask the patient to void the bladder and then sit for treatment, because there is increase in renal blood flow in pregnant patients, and they feel like going for urination very frequently. Then whenever there's increase in vomiting sensation during the treatment procedure, we should make the patient sit upright, and the mouth should be rinsed with clean water or cold water after vomiting. Then positioning of the patient, and mainly during the third trimester, because during the third trimester fetus has grown enough in size, and whenever we make the patient sit in the supine position, the fetus puts pressure on the inferior vena cava, the femoral vessels in the aorta, and there's decreased venous return to the heart, and therefore the patient can present with supine hypotension in pregnant patients. So during early stage of third trimester, if at all we plan a treatment, and during the late second half of the second trimester, during that time it needs to be taken care of, and also we should ask the patient to tilt 5 to 15 degrees on the left lateral position. But if even after that, if it's not relieved, then we need to tell the patient to be completely in left lateral position. Then major surgeries, they need to be, if at all they are needed, they need to be avoided till the second trimester, or if possible they should be avoided till delivery. Then the last thing is coming to radiographs. So radiographs need to be avoided in all the 3 trimesters, especially in the first trimester, because in the first trimester the baby is more prone for any kind of anomalies. So therefore we should avoid any kind of radiographs, especially in the first trimester, unless absolutely necessary. If at all we need to take a radiograph in such patient, the patient should be made to wear lead apron. Thyroid collars may also be used, and also the abdomen of the patient should be covered completely. And in the first trimester, as much as possible, maxillary radiographs should be avoided, because we give a positive vertical angulation, so there's high exposure downwards, whereas if we take mandibular x-ray, we give negative vertical angulation, so therefore mandible x-ray still can be taken. Then proper collimation should be there, then proper filters should be used, and high speed films should be used. If all this is not taken care of, then there are high chances that the baby can present with microcephaly or mental retardation. So coming to the first trimester, so in first trimester, we can do oral prophylaxis, that is scaling, polishing, or curettage can be done. Then any kind of emergency procedure, if it's there, then that can be performed. Only if it is absolutely necessary, we can take up the procedure. Then any kind of treatment otherwise should be avoided in first trimester if it can be postponed to second trimester. Then coming to second trimester, in second trimester we can do scaling, polishing and curettage can be done, and organogenesis is complete in second trimester, so most of the treatments are safe. We can do root canal procedures, we can also do any kind of emergency treatment if they are there. So control of any kind of active infection should be done in second trimester so that the patient doesn't have any kind of problem in third trimester. Then coming to third trimester, positioning becomes very, very important. Scaling, polishing and all can be done in the third trimester as well. But any kind of elective procedure that needs to be avoided, and especially in the second half of third trimester, it needs to be avoided. So that brings us to the end of the video. So if you have any doubts or queries, you can leave a message in the comment section below. And thank you so much for watching. Thank you.